The faculty who is going to be taking today's class, as well as a little brief up again about USMLE. So, hello everyone again, good evening. And I'm Dr. Mala Srinivasan, and I want to tell you today's class, and in the next 3 days, we are going to be having a very special class. This is about the integrated medicine topics with pathophysiology, the most important topics in medicine, which in step 1 there is good number of questions which are very clinical based questions. So there will be some of you in second year or third year, and you'll are asked all the time that there is so much clinical stuff that is asked in USMLE. How do you manage to study that clinical stuff? So today we are going to have with us Dr. Achintya Singh. Achintya has finished his post-graduation in medicine from All India Institute of Medical Sciences, and he is going to be talking to you all on very, very high yield topics like cardiology, acid-base balance, a little bit about endocrine, kidney. These are the topics which are very clinical in nature, but they are asked in step 1. So if for those of you who have done your physiology and they find that during physiology questions they are asking a lot of medicine-based questions, it will be of great help to you. But for those students who have not yet completed physiology as a subject, you may find that some topics are not very easily understandable to you. So you can talk to the teacher, you can talk to faculty, send your questions on the chat, as well as on our Facebook page. You can, send questions regarding all your doubts and difficulties. But pay attention to this class, make your notes for this class, so that tomorrow, whenever you do these topics in physio or patho or any of the subjects of step 1, you will find that these topics are going to be very helpful to you. And there is no other center or coaching which does this integrated medicine topics in step 1. So this is an extremely important subject, and please pay attention. I would suggest that attend live as much as possible all the 3 days, so that you can interact with the faculty, ask him questions, because we are not going to be having this in most of the classes. Dr. Achintya has already given all his USMLE steps, and he's leaving to join his residency shortly in the next 1 month. So we have him for 3 days only. So make sure you're making use of his expertise, asking him questions, whatever questions you want to know, or just pay attention. I have also requested him to tell you the topics that he's going to be teaching tomorrow and day after, so that you can read up a little bit for the class. Okay, so make sure that you're making maximum use of these 3 days. Now, other than that, for all the new students who have enrolled with us in Hyderabad, in Andhra, in so many places all over, all over India, there are many new centers which have enrolled with us. I just want you to be in touch with me. Let me know what your, if you have any problems, or if you have some issues you want to talk to me, please message me first and then give me a call, so that we can chat on all your difficulties. Send me a mail on usmle@damsdelhi.com, and I will help you out with all your journey. So we have a lot of students who are now applying for their electives, for observerships. Some of you who are in the second and third year are planning their exams. I want all of you to talk to me, so that I can help you with your journey and help you plan your journey properly, so that you don't make mistakes. So I'm here to mainly guide you for the entire process. Plus we also have faculty who will be one by one taking all your topics, so that you can complete this topic in the next 15 to 20 weeks, 24 weeks, we will be completing all the subjects. These 3 days, this week extra we have added, because we realize that the topics he will be covering is very useful for you. So I won't take much more of your time. I hope that most of the centers are here. Is there some other question you want to ask me? Is there something else you want to talk to me about? For students who are new, who are still enrolling, and if they have any kind of doubts or anything that you want to talk to me about, please message, so that in the next 5 minutes before Dr. Achintya comes here and starts the class, I can address your doubts and difficulties on this platform. Anything else you want to know, anything else you want to talk to me about, anyone who has any kind of problem, difficulty, or anything you want to tell me about it, please let me know. It is very important that we keep on updating our courses, updating, whatever is the difficulties that you students are having, so that you don't have any problems in future. Okay. So is there only few centers here? I hope all of you are here right now. Most of the centers, let me know if any new center, anything you want to ask me. Anyone else? Do let me know. Okay. And so basically for the class, again, I'm telling you a few things that you are entitled to as a USMLE satellite student. You are entitled to the lectures that you are coming. These lectures are live between 5 and 9 on at least 3 to 4 days of the week. We are providing you with course material. Apart from the course material, we have got a lot of information on the, on the app, on the cloud, on the there is so much material available that is there any major change in the pattern? No, there is no major change, but from May onwards, they are changing. If you see those who have started the USMLE Q Bank, the U World, you will see that they are adding a lot of new questions. Up to 500 to 600 new questions have been added in the last few months. And this is because I think somehow the scores have a little bit dipped from last year, and there have been a very irrelevant, like NBME is no longer regarded as the, whole and soul of USMLE. If you do NBME, you get this score, you will get the same score in the exam. This is not happening because there has been a slight change in the way the questions are being asked and the way they are being marked, because of which the latest UWorld and the latest NBME question bank has to be done. We are also updating the teachers, and the teachers are also going to be updating you on the topic wise questions also, that what are the kind of questions that are going to be asked. There is no change in the pattern, but there is probably a emphasis on clinical, which is more. Certain topics which were not being asked before, those are the topics they have started included. Even in anatomy, there is a lot of new questions that have come. So we will be incorporating all of that in our training. So don't worry about the change in question pattern, and make sure before giving the exam, you are talking to me, and making sure that your preparation is complete before you apply for a date. I'll tell you which is the major, question bank that you can use just before your exam. So at least a month or 2 months before your exam, start talking to me and give me an idea about your preparation. Tell me how many subjects you have done, how many and when one should buy NBME. So basically this is a variable question. It is not necessary that you need to buy all the NBMEs. If your UWorld, first of all, when you start your UWorld also, you should do it in a random manner, you should do it in a timed manner, and you should always do it in a test manner. Okay. So when you start your UWorld preparation also, please speak to me so that I can tell you how you can start UWorld. If you're getting, initially you may start getting 20 to 30% or 40% initially, but later on you may start increasing your score to 70, 80%. When you are coming to that stage, that is the stage when you can start taking your NBMEs. Initially, you must take the offline NBMEs. I'll tell you about the offline NBMEs when you come to that stage. And now, as of now, recently, I have come to the conclusion that only the last few NBMEs, maybe 2 or 3 NBMEs, the 19, 20, 21, these are the latest NBMEs that have come. These are the only ones which have a little bit of relevance to the exam. So maybe you can take 2 or 3 of those exams, but don't buy all the NBMEs because they are no longer validating the score correctly. So don't take NBMEs immediately. Okay. My WhatsApp number is 9811102312. 9811102312. Kindly don't call. Please WhatsApp me before calling, because I get many calls in the day and I miss the calls because I don't know who's calling me. So please message or WhatsApp me before calling so that I know that you are my students and I need to give you a time to speak to me. Okay. If you're not able to access the cloud, please send a mail to manish@damsdelhi.com, MANISH, Manish@damsdelhi.com, and he will help you on how to access all the different sources that we are giving you, including our Exam Master question bank. You have to use the Exam Master question bank because it has a lot of questions which will be helpful for theory recall for you. So after the teacher has taught you those theory, for example, today Dr. Achintya is going to take ECG for you. So you can go back and have a look at Exam Master, all the questions on ECG, and see if you can solve those questions. So that will give you a little bit of a boost, and you will know that you have been able to solve questions based on the theory practice. So use our Exam Master question. Number is 9811102312. Okay. If you have not got the number, mail me at usmle@damsdelhi.com with your roll number, and I will give you my number and a time to talk to me. Okay. Please make sure you're all connected with me. Maximum benefit you will get only with proper guidance. If you just try to study on your own and try to ask seniors at this stage, then you will be losing out, because we will be guiding you the best way possible, the teachers as well as me over here. Okay. Is it okay to start now for a post-internship this from scratch? Yes, it is definitely okay. People are starting after 2 years or 3 years after internship. This year, maximum number of people post-internship have matched. We have had very good match results even after post-internship. It will take you 2 years from the time you start deciding to do USMLE. So if you start now, somewhere in September next year is the earliest you can think of applying. And you have to really hurry up, because there is a pressure that you have already been a graduate for more than a year or more than 2 years. So you need to start working on it as soon as possible, and you need help for such a thing. So make sure you have my number. Please take my ID, usmle@damsdelhi.com, and talk to me. I will make sure that I answer your queries. And again, since this was a new class and I needed to introduce the faculty, that's why I've come here. But I will come again one day just to address your questions. I will take a time, and I will make sure that I will, yes, Belgaum, I will come again, since today I don't want to waste any more time of Dr. Achintya, because this is a medicine class. But I will come back here maybe in a week's time itself, maybe next week sometime. I will come and I will take a half-an-hour class on electives, applications, exam preparation, DAMs, how we can help you, and every of your problems. So keep all your problems ready. Message me when you are all ready. I want to also make a WhatsApp group. We have more than 50 to 60 students who are right now attending the class, and somehow we are not in touch with each other. So I want all of you to be in one group. See the Facebook page. I keep putting a lot of questions on Facebook. A lot of information is there on our Facebook page. So I will come back next week again, and I will have one more chat with you all where we can talk about the exam, the application, electives, especially for those of you who are very interested in electives. This is the best time because a lot of colleges have opened up right now. So let me talk to you about electives also. Okay. So for now, please, pay attention to what Dr. Achintya says, ask questions, open up your mind and attend as much as possible all the 3 days live, rather than taking it on videos, because you have a person who can answer your doubts live, So when you have that, make sure you're using it. Okay. For now, I'll just hand it over to Dr. Achintya, and anytime you want anything else, please message me, WhatsApp me, or email me, and I will fix a time to speak to you individually. Okay. So all the best. Have a good evening, and I will just hand it over to Dr. Achintya soon. Okay. Could you hear it?
Yeah, good.
Okay, all the best then, I'll say.
Yeah. Hi guys, I hope I'm clear and audible to everyone. So I am Achintya. I would be discussing few basic concepts in medicine, and as we go along, I'll try to brush up with your basic physiology and pathology. I understand that you're not very advanced in your clinical training as far as today, so we'll try to make it as simple as possible. We would try to have things, we'll try to understand the concepts other than just trying to memorize it. So the whole purpose of this training is to bolster your concepts and not just your memorization. So please we would try to go more into the depth and less into the breadth. Okay. So we'll be starting with a very basic kind of fundamental concept of medicine, which is electrocardiograms. So it's ECG in India and in England. It becomes EKG when you go across the Atlantic and reach US. So the first things I would like you to understand is EKG is basically a machine. So you should not be worried about what it is showing as long as you understand how it is creating that picture. So what you're doing actually is taking a picture, you're taking a selfie of the heart. What I mean by that is whatever it is showing can be decoded with a set of rules. If you are clear with the basics of EKG, any EKG graph would be one of the easiest and the simplest questions that you can answer. The first thing that we're going to understand about an EKG is the EKG axis. What we call an EKG axis is basically the cardiac rhythm. That is, where is the heart current originating, and from the point of origination, where is it flowing into. This particular aspect is called an EKG. It will be called an EKG axis. When you're trying to understand the EKG, it is called as a 12-lead EKG. A 12-lead EKG is different from electrodes. If you have ever seen a person being placed on electrodes in real life or in the movies, you will notice that they place it on both the arms, both the legs, and across the chest. What is placed on the chest and on the arms is called the electrodes. It is different from the leads. The results from the electrodes is called the leads. I hope this point is clear. What is placed on the chest is called the electrode, and the resultant that we form from the electrodes is called the lead. So basically EKG is the machine is a sensitive galvanometer which detects changes in the electromagnetic potential. So for the newcomers, for people who are just starting off, you hopefully remember the action potential. The sodium goes out and the potassium comes in. The currents that is formed because of that, which we call as the depolarization. So the depolarization followed by this and the repolarization phenomena. This depolarization and the repolarization, this would be detected on your EKG strip. I hope this is clear. As the cells would get activated, it would result in depolarization and in repolarization. This, when detected on a graph, will lead to EKG. So I hope you understood about the electrode versus the lead. There are two different types of leads as far as we need to understand. One we would call as a bipolar lead, and the other would be a unipolar lead. What do you understand by a bipolar lead is that it would have a positive and a negative. So when it has a positive and it has a negative, the electricity would flow from the negative to the positive end. This would form a typical bipolar lead. These leads are your major leads, which are your lead 1, 2 and 3, which are placed on your hands and legs. How it is created, we would go forward to it. When you're talking about, I just read a point that you wanted to see the previous slide. This is the slide. There's nothing to be memorized from this. It is just a concept that we are trying to base. What we are trying to say is, on the EKG strip, we are trying to capture the electrical activation on the cardiac membrane. The depolarization of the heart cells and the repolarization would be caught on the EKG strip. What we mean by a lead and an electrode is the placements that would happen on the chest or on the arms. The lead would be the resultant from it. There are two types of leads, which is a bipolar lead and a unipolar lead. The bipolar lead means it would have a positive end and a negative end. And the electricity, as you know, has a negative charge, so it would go away from the same charge and towards the positive electrode. This type of bipolar lead are lead 1, lead 2 and lead 3. There are certain leads which is placed on your chest. Those, the precordial leads, which are called the chest leads, V1 to V6, only have one electrode, that is the positive charge, and everything else is taken as a 0. So it is from a 0 to a positive charge. there are something called as an augmented leads, which is the AVL, AVR and AVF, which are again single pole leads. Single pole leads, which is that is the reason it is augmented. So it just means that L is your left leg, L is your left arm, R is your right arm, and F is your foot. You don't need to copy all this. What you need to do is you need to understand what we are trying to do. What we are trying to do is we'll get to it eventually, and I'll tell you where you need to make the notes. Okay? Any idea on who this guy is? So he is Sir William Einthoven, and he's the guy who created the string galvanometer, which is called the EKG. This is just a trivia so that I can help you all be very good, the person from Goa who answered. So he got the Nobel Prize for it, and people who are interested in trivia, he named it PQRS waves because he was not sure if they are the first waves of the heart or the last waves of the heart, which is back 200 years from now or 100 years from now. So that is why he named it PQRS, which is the middle alphabets, and he left the earlier alphabets and the later alphabets for anything if it is discovered later on. So we'll now talk more about how we generate the leads from the bipolar electrodes. When you said we have two electrodes, so it is basically, this is hidden for some reason. I'll just help you get a glimpse of it. So I hope it is clear now. So what we are trying to do is we are trying to place a triangle around the heart. What you're trying to do is you're trying to take a photograph from the up and from the bottom. So what you're trying to do is place different cameras at different angles so that you can image the heart from as many areas as possible. When you say image the heart, is you are trying to capture its electromagnetic potential. So the heart is kept in the center of the triangle, and all the axes of the bipolar electrodes are equilateral to it. So this is how it looks like. So when you say we have two electrodes, one at the left arm and the other at the right arm, what is generated because of this bipolar electrodes is called as the leads, which would be your lead 1. So the lead 1 with the arms outstretched would be looking at your heart from the top. When you keep one on the right arm and the other one on the left leg and you join them, this electrode would be your lead 2. Lead 2, if you look at it, it is looking at your heart from this is the right side. As you can see the vena cava here, so it is looking from your heart from the right inferior position. Similarly, the lead 3 is looking at your heart from the left position. So what you're trying to say is, if your heart is kept this way and here is your SA node and it goes down to your Purkinje fibers, it is starting from here, that is your SA node here. This is what your electricity is going to be, and this is how your current is going to flow. And the current always will flow towards the left side. That means it will, because the left ventricle will take more time to get activated, so the current will flow almost more towards the left side. So if you have only the 3 leads, for a basic understanding, your electricity flows somewhat like this. Is that clear? It starts somewhere very close to the lead 1 and it goes away from the lead 1 towards lead 2 and lead 3. We'll get more into depths of it, but this particular thing is called as the Einthoven's triangle. The Einthoven's triangle is an equilateral triangle. So all these axes are at 60 degrees to each other. Every angle here is 60 degrees. That's what is a equilateral triangle. So when you extend these angles backwards, you take these extensions backwards, you can form an axis here. And that is exactly what we have done. So this was your 2 arms that were outstretched, and this was your one side and this was your other side. We've just connected them to a point where they intersect. So if this is 0 degrees, 2 would be what degrees? It is at 60 degrees to that, so it would be 60 degrees. And lead 3 would be 60 degrees to lead 2, and hence that would be 120 degrees. So this system is the triaxial system of Einthoven. Now if you notice this, anything that starts at 0 goes to the other side, this angle becomes 180 degrees. Now conventionally, what you understand is, when I go from here, I can name it in two manners. I can either keep on increasing like 180, then it will become 190, so on and so forth till 360. But when I call it 360, lead 0 would become 0 degrees will become 360 again. So this was a big problem. This is a bit problematic, and what it is done is, anything above this axis is in minus. It is the same degrees, but it is minus axis. So when lead 3 was 120 degrees, it is supposed to be at minus 60 degrees to lead 1. And similarly, it would be minus 120 degrees for lead 2. So what we'll do is, because to maintain a certain amount of smooth flow into this, I would appreciate if we can go, I'll try to explain it till the end, till I have come to the hexaaxial system. And then Manipal, I'll try to see if you have understood. If not, then I'll trace back a couple of steps. Is that okay? Okay. So the triaxial system is 0. What we did basically is, what we had this system and we just extended it backwards. We extended it backwards till the point we can find a axis. We could find a point where all of them bisect each other. Okay, this is how we came up with this triaxial system. So one more trivia, this is how the initial EKG looked like. So these are your lead 2 and lead 3 and lead 1, and this is how it is created. You can see Einthoven, or whoever the first person was, he has kept his hand submerged into 2 electrodes, which were nothing but salt water jars to detect electricity. So with this you understand how the axials, how they were trying to form the various axes here. Okay. Now as we move on, so there are 3 more leads which are called there are other leads which are the unipolar leads. So unipolar leads, as we just said, that this has only one charge, which is a positive charge. So a positive charge, so every other is considered to be a 0 potential. The extremity leads have low potential, and to detect electricity from that low potential, they were augmented. So it is basically whatever recordings they're going to have, it would be increased by a particular level by the machine itself. Hence it is called as AVL. The A stands for augmented. This augmentation is represented by A. So we'll first understand how we are going to place the various precordial leads, and this can be very well understood by this. What I want you to do is pay particular attention to the heart. How is the heart structured and how we are trying to wrap around the heart in a particular manner. What we are trying to do, starting from the right side of the heart, we are trying to go all across till the left side. So what we do is we go from the 4th parasternal right up to the mid-axillary 6th intercostal space. Sorry, the 5th intercostal space. So we go to the 5th intercostal space, mid-axillary line. So this is which is in the 5th intercostal space. What we are trying to do again is, first we took pictures from the sides, and now we are trying to take a picture from the top. So when you're taking a picture from the top, this would not give you a fair bit of idea about the about the axis, that is the direction, it would be used in localizing of lesions. You can note this point. The precordial leads are most useful in localizing the lesions because it would have different recordings for the right side of the heart and different recordings for the left side of the heart. When we were talking about the triaxial system, we came up with the 0, 1, the 1, 2 and 3 bipolar leads. Now this is a man standing right here who has one more leg here. So this is that one lead is attached to the AVR, that is your right hand, the other is attached to your left, and the other is attached to the foot, which is your left foot. Because this is a unipolar lead, so it has no different, it won't have a straight connecting line, but it would be a dot because it is plus only in that spot. There is no negative electrode here. To understand what we do is, we have placed this again. These are such that it is at 60 degrees to each other. So again the angle between this would be 60 degrees. AVF, which is your foot, would be at 90 degrees. So whatever would be your other leads would be plus 60 degrees to that. If it is 60, the AVR here would be 30 degrees. And this is 60, this would be 150 degrees. Now, when we were discussing about the 1, 2 and 3 electrodes, we said anything that goes above, that is above 0 degrees on that axis, would be labeled in negative. So when this is plus 90 degrees, this would become minus 90 degrees. When this is minus 90, anything here would become minus 30 and anything here would become minus 50. Now, as the electrodes are actually placed in this area and not here, it is placed here. So the AVL is considered to be at minus 30 degrees and the AVR is at minus 150 degrees. I have two doubts. So the thing here is, so this is what we are trying to generate, all right? What we said was, when we first had the patients, what we were trying to say was, we were developing a system, okay? When you saw this was the person who had the leads placed at different areas, okay? So this was your lead 1, lead 2 and lead 3. I hope this much point is clear. When you want to develop an axis, you have to extend these lines backwards. So these lines are extended where all these three are going to meet each other. Is this point clear? We have geometrically extended these lines so that they can meet. They would meet, again, the angles would not change. We are doing this so that we can develop an axis. We cannot just assess it on the basis of a triangle, right? We have to develop an axis. Is that clear? If you don't develop an axis, you cannot identify only on the basis of a triangle, because the next leads that you have is AVR. Here you have AVL and here you have AVF. So you need to delineate different axis groups. Because this axis, where is this seeing, is this is seeing the heart from this direction, and this is seeing the heart from this direction, okay, and this is seeing the heart from this direction, and all of it is at 60 degrees to each other. So this becomes 60 degrees. So as this is 90 degrees, this was supposed to be 60 when it comes this way and this way. Is it clear? I'm waiting for your answer. The point here is you're trying to develop an axial system. So we have the AVL, the AVR. I'll redo the whole thing because this is important and this is not as difficult as it seems like right now. The thing is, when you have placed the electrodes, this was your lead 1, lead 2 and lead 3. Okay. When you made the augmented loads, those were unipolar electrodes and unipolar leads. So a unipolar would be AVR, AVR, AVL and AVF. Alright. This is like you have placed a camera at a particular point. If you have placed the camera here, this is a telephone camera and this is a telephone camera, you are viewing the heart from which axis? You are viewing the heart this way and you're viewing the heart this way. And this is something which is kept on the floor and watching upwards, which is this way. Okay. All of this axis would bisect each other. We can continue that and it will bisect each other. When it bisects each other, that angle would be 60 degrees. That is how it was made. You cannot say why 60 degrees because that is the whole purpose. It was created to be at 60 degrees. Now the point that you are facing, the problem that you are facing is you are confused how these electrodes are suddenly forming a axial system. What we did was, if you move this line, this left arm, and you draw it here, okay, I'll choose another color for you. If you draw your left arm, this would again be 0 degrees, right? This is all. The left lead, that your lead 3, was now, we shift its angle in such a way that it intersects the 0 degrees. It will intersect here. Okay. This would become your lead 3. And your lead 2, again, you want a common origin point. You want a intersecting point. So you will shift your lead 2 and form it somewhere around here. So basically this line now is your lead 2, this is your lead 1 and it is your lead 3. That is your 3 angles, your 3 sides have now been shifted so that they intersect each other. Is this point clear? Is this point clear, Manipal and Goa? Okay, great. So when you have this angle, this is how you kept it. This was just to make you understand that when you created this, when you made this intersections, because they were always at 60 degrees to each other, when you shifted it this way, it is again at 60 degrees to each other. So the 60 degrees would always be static, constant between all the 3 different leads, that is lead 1, lead 2 and lead 3 will always have a 60 degree angle to each other. Okay. So if my lead 1 is 0 degrees, my lead 2 should be 60 degrees. And my lead 3 would be how much to lead 2? It would be 120, that is 60 plus 60. Okay. So this is basically this angle and this angle. Now to consider the angle between lead 3 and lead 1, you are seeing this extension back here. This would again be 60 degrees. Okay. But to call it lead 3, we need one place where it would be lead 3. That means this is your lead 3. This would be the opposite of lead 3. I don't think it is visible. It is the opposite of lead 3. This area, lead 2, this would be the opposite of lead 2. Okay. So when it is the opposite of lead 2, by convention, it is placed in minus. Those angles, anything above the 0 to 180 degrees would be in minus degrees. That means the same degrees would be repeated, but it would now become minus 90, minus 80, minus 70, minus 100, so on and so forth. When this was 0 degrees, anything behind 0, which is at 60 degrees, will become minus 60 degrees. Okay? Anything that is minus 60 degrees, and what would be lead 2 and lead 3? Difference would be 60. So this was 60, minus 60, minus 60. So this will become minus 120. When you are asked what is the axis of lead 1, that would be 0. What is the axis of lead 2? That would be 60. What is the axis of lead 3? Would be 120. Opposite of lead 3 would be minus 60, and opposite of lead 2 would be minus 120. I hope this point is clear. All right. After you have developed, so this is the basic triaxial system that was first developed by Einthoven. Okay. That is, you place the hands like this and one on the limbs, and that is how your 3 axis. If you see, the heart is now divided into so many 60 degree axes. All right. The electricity of the heart can be mapped on a 60, 60, 60 angle wise. You can divide it. That is what we are trying to do. But we also had 3 more leads which were placed on your limbs, which will also have a axis of their own. Okay. This axis system is the AVL system. Now, when we drew on the first diagram, which I hope you remember, I'll just show it to you again. This one, you remember this. So we had the 0 degrees here, but we also developed the other axial system, which was of AVL, which we said would go right here and intersect it at a particular angle here. So this would become AVL. Your AVR will start here and will intersect at a particular angle, and this would be your AVR. And here at 90 degrees, again there is one more. So what you tried to do was, from the big 60-60 chunks, you again divided into 30-30. That means between 2 different systems, the angle would again be 30 degrees. That is simply, you're saying that there are 2 equilateral triangles which you are kept over one another. Okay. When you see this triaxial system of AVL, so the AVF electrode is at 90 degrees. That is your foot electrode. When you are standing erect, that is your leg. It is the foot electrode, which is 90 degrees. All right. I hope this is clear. So what you had was your lead 2, which was somewhere here, and if you remember, it was 60 degrees, lead 2. And you had your lead 3, which was here, and it was 60 degrees to lead 2. It was 120 degrees. Now you see the heart is placed into 60, 90 and 120 degrees. That is, it is placed in 30, 30, 30 in 3 positions. Okay. The AVL electrode is your left side, which is this one. It is here. All right. And here was your 0 degrees. That is your lead 1. We said anything above 0 degrees would be negative. What would be the difference between AVL and lead 0? Between AVL and lead 0, like these are two different leads. Correct, very good. So this would be 30, because everything is, see, AVF and lead 2 30, AVF and lead 3 30. So this 30 degrees, but because it is above the axis, above 0 degrees, so it is called as minus 30 degrees. Is it clear? Correct. So this is how we created the AVL system. How we got minus 30 degrees for AVL. Now when you see the extension, what we call the opposite of AVL. Opposite of AVL would be 30 degrees to lead 3, and it would become 150 degrees. It is not important. It is just for your understanding. Okay. And then you have the AVR. AVR would be 60 degrees away from AVL. Right. So this would become minus. So it would become minus 30 minus 60, which would become minus 90. Sorry. So this here, it is going backwards. This is you have to calculate it from the 180 degree mark, because this is minus, right? So this is minus 150. It was 0 degrees, and you have to have a change of 30 degrees from your baseline. From your baseline, you have to have a change of 30 degrees. So this is what you did, and it became minus 150 degrees. Now there are two ways to do it. You can either just remember all of these values, or you have an understanding of this. Remembering that AVL is minus 30 degrees, you might forget it at times. But remembering that AVL is above lead 1 and all these leads are at 30 degrees difference to each other would help you remember it as minus 30. You want me to use another color for which number? Okay, it's not visible. I'll use red. So this is minus 50. This is minus 150 because of the difference from 180 degrees. Is this color better? Okay. And this becomes minus 30 degrees. Is that clear? Now, why are we so hell-bent on understanding all this? Is because of this diagram. If you look at this diagram, what we have tried to do is we have tried to map out the whole axis, and what we are going to do is we are going to have the cardiac conduction system. Okay, and we are going to place the heart according to all your electrodes. So here the electrode which is not visible would be AVL. Alright, I hope you understand what we are trying to do right now. So what we are trying to do is we are trying to place the heart according to all your electrodes. Is it visible? Axis diagram again. I think you'll understand it better through this diagram, Kolkata. What we are trying to do is, this was your 0 degrees, this was your 90 degrees, this became your minus 30 because it is looking the heart from the up above 0 degrees. This becomes your minus 150 degrees because it is 30 degrees to minus 180 degrees. Because this was 90, this becomes 60, because this is 0, this becomes 60, and this becomes your 120 degrees. Is it clear now? Do you get an understanding of what is going on? Okay. Now we understand a concept of vectors. What is a vector is basically anything which has a magnitude and has a direction. Okay. So it means that it should have a particular direction, like it flows from the west to the east, and it should have a particular quantity attached to it. So if you consider the cardiac conduction, it is actually a perfect vector. So when you say the cardiac conduction, it may be like for supposedly your right ventricle, the current flows into the right ventricle, right? And say you require 120 joules of electricity for a right ventricle to get activated. So it has a direction, comes towards the right ventricle, and it has a magnitude 120 joules. If a patient develops right ventricular hypertrophy, that is, he becomes more beefy and muscular, he would require 300 joules of electricity. That means the magnitude increased. There was an increase in the magnitude. And there is a direction also, it becomes more towards the right ventricle. So this is the concept of an electrocardiogram. An electrocardiogram will have a direction and it will have a magnitude. I hope this would get much more clear as we move along. That means it is trying to show you, one, that the electricity is moving from this end to the other end. Second, it's trying to tell you this is the magnitude at which it is moving. Is it clear? So P, Q, R, S, T are all expressions of the waves of depolarization. That is what we discussed, the sodium, potassium, your ATPase. You are masters of depolarization. You know much more depolarization than I do. But that is what you're trying to detect. When an electrode gets the current, it has a positive deflection on your EKG. When an electrode gets a current, it results in a positive deflection on your EKG. When an electrode has a current going away from it, it has a negative deflection on your EKG. This can be considered money. If you receive money, you become more positive. That is, you have a positive deflection. If you lose money, you become more negative. Is that clear? It's a very basic concept and it will help you everywhere you go. Is this point clear? How you get a positive spike or you get a negative spike, how you get your T wave inversions, T wave, tall T waves, T inversions, flat T waves. This is how it is all being generated. Is that point clear? Kolkata, Goa, Nagpur. I'm waiting. All right, great. So when you understood this, so understand one more concept. So this is the concept of direction. Okay, this is the concept of direction. That means if it goes towards it, it gives to a positive spike. If it goes against, it gives to a negative deflection. Okay, this was direction. Now you understand the magnitude. When you consider magnitude, if it is 100 joules of electricity reach a particular area, it will give rise to one spike. If you get 300 joules, it will give to a big spike. Okay, if 100 joules goes away from that area, if 100 joules go away from that area, it gives to a negative deflection. If 300 joules go away from that electrode, it gives rise to a deep inverted deflection. This is the concept of magnitude. That is, more electricity goes, bigger your deflections will be. Very simple, very straightforward. when an electrode gets no money but loses no money, that means there is no positive gain or loss to that electrode, what does that electrode show? When you have an EKG, if this is your P wave, this is your something like a QRS complex, this deflection is called a positive deflection because it is net in positive. The QRS is in net in positive. Excellent answer, Goa. Excellent answer. When you have a negative electrode that it goes away from it, it will have something like this, which is a negative deflection. When the electricity is going at parallel to it, that means it is going in this direction, it will not have a straight line, but what it will have is a net neutral direction. That means it will have an equal deflection, that is the positive element would be equal to the negative element. It cannot be called a positive electrode, a positive deflection, nor a negative deflection. So to assess the directions, you have these three main ways it can have a deflection. It can either go up or it can either go